Ever felt that sharp, shooting pain down your leg? Chances are you've heard the word sciatica. But what on earth does that actually mean? You know, the pain can feel so random, so illogical. So today we're going to pull back the curtain and really demystify what's happening inside your body. You're going to see why knowing what is causing the pain is so much more important than just knowing where it hurts. So tell me, does this sound familiar? Does your pain just seem to have a mind of its own? Like one day it's in your back, the next day it's zinging down to your toes. Maybe sitting is torture on a Tuesday, but by Wednesday it's the only thing that gives you relief? If you're nodding along, you are absolutely not alone. These confusing patterns are classic. Let's get really specific here. Are you dealing with that sharp lightning bolt pain? Or maybe it's more of a deep, burning ache that follows a very specific path. How about that buzzing pins and needles feeling in your foot? Maybe sitting makes it flare up, or standing is the real killer. And don't even get me started on trying to find a comfortable position at night. If this is you, I want you to know what you're feeling is real. It's not in your head, and it's not random. There are predictable patterns here, and we're about to figure them out together.
Okay, let's get right to it. This is probably the single most important thing you need to understand. The word sciatica. It's incredibly misleading. Why? Because sciatica is not a diagnosis. It's just a description of a symptom.
That's it. All the word sciatica means is that you have pain somewhere along the path of that big sciatic nerve. It literally just tells you where it hurts. It gives you zero information about what is actually causing the problem. Let me give you the perfect analogy. Saying you have sciatica is exactly like saying you have a headache. Okay, it tells me where you hurt, your head, but it doesn't tell me why. Is it from dehydration, a migraine, tension, a sinus infection? You wouldn't treat all of those the same way, would you? Of course not. Sciatica is the exact same idea, just for your leg. In this picture here shows it perfectly. You could have a disc herniation, something called spinal stenosis, or even just a muscle squeezing the nerve in your hip. And all of them can create that exact same sciatica pain down your leg. But the treatment for each one is totally different. This is why just Googling sciatica exercises can be such a recipe for frustration. You have to know the what before you can fix it.
So why does this whole thing feel so complicated and just stuck? Well, it's because it's almost never just one single thing going on. It's usually a chain reaction, what we call a three-part problem, and each part feeds the other. Let's break it down.
First, everything has to start with a source. This is the original problem, right? The thing that first irritates the nerve. It could be a bulging disc pushing on it, maybe the bony canal the nerve lives in has gotten a little too narrow, or maybe a muscle is squeezing it. Okay, part two. That source triggers a response from the nerve itself. The nerve gets, well, it gets angry. It becomes inflamed, it swells up, which is a huge problem in the tight spaces it has to travel through. And critically, it loses its ability to slide and glide when you move. So now the nerve itself has become its own pain generator. And part three, your body, trying to be helpful, creates protective changes. Your hamstrings, your glutes, your back muscles, they all tighten up to act like a natural brace to guard that angry nerve. You might even start limping or leaning away from the pain without realizing it. Now, here's the key. That muscle tightness, it isn't the problem. It's your body's attempt at a solution. And right here, you can see how this all connects into one big, vicious cycle. The source irritates the nerve, the angry nerve triggers the muscles to guard, and all that constant muscle tightness can sometimes put even more pressure right back on that original source. This is why the pain can feel so persistent and so hard to shake. So once you understand that three-part problem, it lets us bust one of the biggest myths out there about sciatica, the idea that you should just stretch it out. I mean, if you've ever gone on YouTube, found a stretch, and it actually made your pain worse, you're not crazy. There's a very real reason that happens. I want you to read this quote on the screen and really let it sink in. The tightness you feel is frequently a bodyguard, not the enemy. That tight feeling in your hamstring or your glute, it's not the villain. It's a bodyguard your nervous system hired to protect that irritated nerve. And you do not want to fight the bodyguard. This image is so important. Look on the left. A healthy nerve is designed to slide and glide smoothly through your tissues, kind of like a well-oiled cable. Now look at the irritated nerve on the right. It's swollen, it's sticky, it's stuck. When you do a big, aggressive hamstring stretch, you're not just stretching the muscle, you are yanking on that angry, sensitive nerve. It's like pulling hard on a frayed rope. It can literally pour gasoline on the fire of inflammation. And listen, this isn't just a theory, it's actual measurable physiology. Research shows that once the pressure inside those spinal tunnels gets above 50 millimeters of mercury, it can actually block the nerve from working properly. So what's the average pressure created by a disc herniation? 53. This is a real physical pressure problem we're talking about, not just tight muscles. So if stretching isn't the answer, what is? Well, it all comes back to that one single thing: getting an accurate diagnosis. You have to identify the true source of the problem, because that's the only way to find the right path forward.
And if you're still not convinced, this slide should seal the deal. Let's just compare two of the most common causes of sciatica. For a disc herniation, bending backward often provides relief, and bending forward makes it way worse. But for spinal stenosis, it's the complete opposite. Bending forward feels good, and standing up straight or bending back is agony. So can you imagine if you have stenosis and you start doing exercises for a disc herniation? You're not just spinning your wheels, you are actively making the problem worse.
This is why effective, modern care for sciatica follows a very clear, logical pathway. It never starts with just random treatments. Step 1, always, is a thorough evaluation to figure out the specific cause of your pain. What's the source? What's your pattern?
And once we know the cause, the recovery process actually makes a lot of sense. Phase 1 is just first aid. We have to calm down that angry nerve and take the pressure off. Then phase 2 is rehabilitation. Once things are calmer, we can gently start to restore the nerve's ability to slide and move properly again. And finally, the performance phase. This is where we build strength and resilience so this whole thing doesn't come back.
Now, one last thing that's incredibly important: you need to know when to seek care. While most sciatica gets better with the right approach, there are a few red flag symptoms that you can't ignore. If you ever experience sudden changes in your bowel or bladder control, or numbness in the groin or saddle area where you'd sit on a bike, this is a medical emergency. You need to go to the emergency room immediately. It can be a sign of a rare but very serious condition.
So that really brings us to the final, most important question for you. Have you been stuck in that cycle of just treating the symptom, chasing the pain, stretching the tightness? Or are you ready to find the true source of the problem? Because as we've seen, understanding the what behind your pain, that's not just a nice piece of information. It is the first and the most powerful step you can possibly take toward getting lasting relief.